Good day everyone, I am April Pai A. Magan and I will be discussing about the maneuvers in Leopold. For the Leopold's maneuver number 1 or LM1, it determines the location of the fetal head and the fetal buttocks and use this when measuring for the fundal height. It also determines the gestational age and fetal lie. The first maneuver is also called the fundal grip. Uterine fundus is palpated to determine which fetal part occupies the fundus. Fetal head should be round and hard and ballotable. Breech presents as a large nodular mass. Gestational age can be evaluated using the fundal height or McDonald rule. The uterine fundus reaches the pubic symphysis at the 12th week, a point midway between the pubic symphysis and the transverse umbilical plane at the 16th week, the transverse umbilical plane at the 20th week, and having crossed this line, it is assumed that each transverse finger bread corresponds to 2 weeks. Now for the second maneuver or LM number 2, this is to determine the location of the fetal back. It is also called the umbilical grip. Palpation of the paraumbilical areas or the sides of the uterus. Fetal back feels like a hard, resistant, convex structure. Fetal small parts feel nodular and irregular. And now for the third maneuver, or LM number 3, this is to determine what fetal part is lying above the inlet or the lower abdomen. It is also to identify whether the status of the presenting part is engaged or floating. The third maneuver is also called the Pollick's grip. Suprapubic palpation using thumb and fingers just above the symphysis pubis to determine fetal presentation and station. The differentiation between the head and breech is made as in LM1 or the first maneuver. If presenting part is not engaged, a movable structure can be palpated. For the fourth and the last maneuver, or LM number 4, it determines the degree of flexion of the fetal head. It also determines the attitude and the habitus. So the fourth maneuver is also called the pelvic grip. It is used in the last stage of pregnancy to determine how far the fetus descended into the pelvic inlet. Palpation of the bilateral lower quadrants to determine engagement of the fetal presenting part. Fetal part is engaged when the examiner's hands diverge. On the other hand, fetal head is not engaged when the examiner's hands converge. And note, if the fetal head is felt on the same side of the fetal back, fetal head is well flexed. Now let us move on to the course learning outcome number 4.2, which is the guidelines in performing Leopold's maneuver. First and foremost, we need to explain the procedure to the client and then instruct the female to empty her bladder before performing the maneuver so that she will be comfortable and the contour of the fetus will not be obscured. The explanation reduces anxiety and enhances cooperation. An empty bladder also promotes comfort again and allows for more productive palpation because fetal contour will not be obscured by a distended bladder. And then put the woman in dorsal recumbent position or supine with knee flexed to relax the abdominal muscles. The third one, drape the patient properly to maintain privacy and place a pillow under her head. And the next, explain the procedure to the patient and answer any questions that she may have. Next is to make sure that the examiner's hands are warm before coming in contact with the patient's abdomen. Rub the hands together vigorously to prevent uterine contractions. Another one is to use the palm of the hand instead of the fingers. And then the last one, the nurse should stand with the body facing the patient during the first 3 maneuvers and then facing the feet of the patient during the final maneuver.